So my name's Alexandra. I'm a GP trainee in East London, and I worked with Single Homeless Project, and our project was called Walk With Us.
Great. Super.
All right.
Thank you very much. I think that was everything.
I think so. Right, I was like looking.
That's
fine. When we first started, so SHP gave us a very broad remit to our project, and just wanted something that involved health promotion. So we did some background questionnaires to find out what would be most helpful to their client groups. They work with a homeless population that has quite a significant proportion of health needs, and notoriously quite difficult to engage within sort of the classic healthcare settings. So we realised that what they maybe would want is to get involved with some exercise programmes. What we did was that we thought we'd start a walking group. So very simple, very straightforward, very achievable, something that they could then sustain after we'd set things up. So part of it was to develop a walking group, and the other part of it was sort of a health promotion educational side to it for the key workers, so delivering a presentation to the key workers. And so we presented and we had the opportunity to show the other volunteers what we'd done over this time, and to also present to the rest of Team Up. They just need your help to give them that first boost, and then it's off. SHP have done amazing things since last year. I think it makes you think about your role in the community, and actually using the resources that already exist in the community, and tapping into that wealth of knowledge that maybe we don't have, in order to engage more vulnerable members of our community. Caesar's bit, speaking to the managers, they were able to tell us that these are the main challenges to why they're not seeking healthcare. It's difficult to access. There are a lot of barriers. People don't really engage very well, and this is something you don't really think about when you're in a sort of a clinical setting. How do you reach more vulnerable members of the community? You have to think laterally. So the structure of how the voluntary sector works, and what their limitations are, and perhaps trying to guide them a bit more into the emphasis of healthcare provision as well, in sort of a preventive role, which is really important. Especially as a GP, I really appreciate how important it is to actually prevent and make sure that everyone takes ownership of their own health. So my favourite thing is probably I met some really nice people, some really good people that I'm still in touch with, and actually even after we finished our project, we've been in touch with SHP. They've invited us along to their walks, and invited us along to some events that they do in the community, which are amazing. You're using your expertise and your knowledge, but you're not necessarily providing medical help as such. And I haven't really found that before, and that's something that I thought was really important, because also it doesn't involve that much extra work, and you're doing quite a lot of good. You can actually create something huge. So one of the things that we all learned, sort of reflecting on this, is communication with in sort of trying to be flexible about how you communicate. In lots of email conversations, phone conversations, it was quite difficult for us to meet up in person often, but actually I think that gives you makes you a bit more flexible about how you do things, and commit to a long-term project, even if it's difficult to physically meet up. Working with Team Up, your role is very much a health advisor role, and you're really there as a supportive role, which is very different to what you do in your day-to-day sort of job with patients. And it's fascinating. It's really fun. 3 words. I'd say fun, educational, and rewarding.